The reason I'm having a consultation today is because I've thought for many years that I wanted a tummy tuck. My general expectations after surgery are basically to have a flatter stomach, because at the moment I get asked whether I'm pregnant or not. Because being smaller everywhere else, my stomach seems to stick out more than it should, according to my body size. So that would be the result that I'm looking for. My first pregnancy was with my son Xavier in 2007. My second pregnancy was with my daughter Inara, who was born in 2008, and my last pregnancy was with my son Caleb, who was born in 2009. All my pregnancies were natural, so I had no complications with any of them. They all went quite well. At my heaviest weight, I was 10 stones, and at my lightest weight, I was 7.5. At the moment, I'm a size 8. My largest size would have been about a 14, but I feel I'm at my most comfortable at 8. My diet is very healthy, I think. Eat a lot of vegetables and meats in moderation. I train between 3 to 4 times a week, running, cross-trainer, weights. The consultation was wonderful. Mr. Berry answered all my questions and was very helpful, actually relaxed me as well in all the things that I was worried about. The girls in reception were really helpful as well. Julie later sent me stuff through the post to read through in my own time, so I could just recap on everything that I'd gone through with Mr. Berry and things that I hadn't gone through with Mr. Berry. And after reading through it all, my mind was put at rest that I actually definitely wanted to go ahead with the surgery. Before the operation, I met the anaesthetist. He came in and introduced himself, and I later saw him in the surgery room. When I was coming round, I was quite sleepy. I felt quite heavy. And quite difficult to move around. But after, I think in the morning, I was a lot better. I could move around, I could get dressed, I was walking around, so it was a lot better than I'd expected it to be. After the operation, I had no sickness or any ill feeling within myself at all. I did, however, take a few painkillers, only as directed by Mr. Berry, which I think did help. I had drains in when I woke up, but they took them out before I left to go home, which I was quite lucky about. The recovery was better than I had expected. The swelling is slightly still there at 8 weeks, but it's going down every day, I have noticed. But straight after the operation, I found it a lot easier to move around than I actually thought I would have. When I got home, I was in bed for the first day, but then I could change my clothes, I could get up from the bed, go downstairs, watch telly, as I took it easy for the first couple of weeks. Cooking was okay, getting dressed, having a shower, because you know it's there every day and you want to feel better about yourself. Just because it's not seen every day doesn't mean that it actually doesn't make you feel horrible about yourself. With the job that I have, I want to feel good about myself, and even in day-to-day life I want to feel good that, you know, the clothes that I wear hang off me properly. So it was very important for me to get it done. Now that it's about 8 weeks after surgery, I'm more than pleased with the results that I've got. A million times better than what I had before. I mean, the only thing now is the scar, which I'm not worried about at all. It's absolutely fabulous. I went away to Spain last week to go and see my in-laws. It was about 35 degrees out there, so I was able to wear my bikini for the first time in years. It was absolutely wonderful. Nobody actually noticed the scar at all. None of the family members or even people didn't ask, why have I got a scar there? Couldn't see it.
She was very keen to have the procedure. She instigated the conversation between Mr. Berry and herself. I attended the meetings with her, or the consultations, if you like, and she was the driver in the whole force. I don't think she felt under pressure by either myself or Mr. Berry and the team. I asked her why, and she explained her reasons. That she wants to feel better, look better. And we are very lucky. We live in a modern society. I'm a full-time sportsman. I get injured and damage my knee, surgery's taken place. She's had 3 children, she can afford it, she wanted it, and the team, she may have seen somebody else and not has been as satisfied as she was with Mr. Berry. She met the team and they were so wonderful, but her confidence has greatly improved. She wears some of the clothes that she used to wear.